Good afternoon, everyone. Welcome to another episode of Spilling Tea. I'm your host, Tiffany Daniels, and yes, we are getting back to our little mini series in regards to Medicaid, the cuts that we are looking at, and why we can't necessarily trust these individuals. Looking at you, GOP, who are going to try and tell us that those who really need the services aren't going to lose them. First off, any government official, Democrat, Republican, so weird party that where Vermin Supreme comes from, he's kind of a parody guy. He runs every year for the presidency race. You get the point. Exactly why what we're looking at is incredibly bleak. Because, folks, remember what they're actually saying to you when you say things like that. I had to learn the hard way, so I want to first go ahead and apologize for the things that I said yesterday. I sometimes run my mouth before my head's able to catch up. So I do apologize and did not mean to be insulting, but I need you guys to know, government official, no matter what party they're from, if you ever hear in regards to Medicaid cuts, them mentioning that those who most need it are still going to receive it, take it from me, that should make you more paranoid, not less. Because who is then going to be left in charge to make that determination in regards to those who they feel really need it, as opposed to the ones that don't? And in particular, if it's government officials, they have no clue how the service system works, where the Medicaid funding, how it gets channeled throughout the service system, what it covers, why it's covered. They do not know a single thing in regards to this field. They are the last people on planet Earth that you should be trusting when they say things like the people who really need it are going to get it. Okay? Now, I'm going to translate for you what exactly that really means. And even when they say it, it usually turns out to be a lie. Remember that early 2010s crunch that we were under, where they yanked millions of dollars out of Medicaid for this funding of different services through ARC, Nova, a few others like Easter Seals, right? Okay, so translated, what that meant and how it was described to me by my boss, the supervisor of the regional office out of our part of the state for the southwest part of Missouri, translated it thusly. Essentially, the criteria now had to be exceedingly narrowed because there wasn't enough money to be able to cover other individuals. What this means is those of us with developmental disabilities, in particular those of us who have more of invisible disabilities, got left out in the cold. Individuals who very, very, very deeply needed things such as direct care staff, people to help them with services such as life skills, helping to deal with sensory issues, you name it. People who definitely needed some additional services that would need a little bit extra help inside the home, but because it was invisible, and a lot of these individuals like me had IQs like myself over the 130 mark. They got told no. And then they usually, right afterwards, got sent directly to my office where I had to try and scramble. Reach out to places like Centers for Independent Living and a lot of times to one of the Catholic charities. Sometimes you can find programs through there. And yeah, so a lot of people got left out in the cold. What they essentially meant is when those cuts happened, the funding that was left was to be prioritized for people who paraplegic, people with cerebral palsy, people who are non-vocal, people with severe mental health issues. Like, to give you an example, like the gentleman that my mom was assisting back in the day, back when the state hospital out there at Mount Vernon, Missouri was still the state hospital, who was like throwing TVs outside hospital windows, kind of thing. Okay? That's what we were told when it was rolled out. What that looked like in reality, however, is they ended up taking even more out than what they initially told us. So what that actually looked like is, particularly if it's a war far away involving people and causes that we had nothing to do with. Frankly, the American people did not receive transportation costs in regards to getting people more physical disabilities to and from their medical appointments got chopped in half. We're talking with people who are medically fragile. Transportation cut in half. Okay? And not just that. The time covered for direct care staff also got cut. So you had people no more staying overnights with the consumers in their own separate rooms that they had set up for the staff. There was an emergency in the middle of the night because the money wasn't there to pay them. Anybody can tell you who works as direct care. Overnight is usually pretty expensive. So that was cut. That was next. People don't really think about all the multiple things that those with disabilities, the challenges that we face every day. In particular, those who are called medically fragile, people with immune disorders, people who, quite frankly, need you to mask and essentially pray and will themselves through every single flu season. Okay? So, access to and from appointments got halved. So that funding was saved specifically mainly for any real medical emergencies. It was saved for if they needed an updated air tank or anything of that nature. A cut in the pay as well as a cut in the hours for direct care staff. And that is spite of them telling that the people who most need it will retain services. That may be true. What they don't tell you is usually during these cuts, they do not retain all of their services. Okay? They're going to feel it. Not just in what I told you either. In things like medication, costs for the tanks, costs for the feeding tubes, cost for assistive equipment, all of that goes up. Medicaid doesn't. It gets cut over and over and over again. When you need assisted devices, like in their situation, you need them to live. And you're talking about these kind of cuts. These are the things you have to be thinking about. This is the reason why I tell you in regards to these services, you cannot trust the politicians. Not only would I tell you just don't trust them in general, but in specific, especially when it comes to things like this, because in my experience, folks, I'm sorry, these people do not have a single clue in regards to where this funding goes, how's it spent, what it covers, how it's going to affect those that they, in their great wisdom, have determined really need the services. Those cuts are still going to hit them. Okay? And let's talk about that too, because when you're dealing with politicians, okay. So, for the people who really need those services, tell me, are any of these politicians able to tell me, A, who they consider disabled enough for funding, and B, will they approve funding across the board for things such as keeping tanks and feeding tubes at a certain rate? Be willing to spend that little bit extra for direct care staff for those who are a bit more medically fragile and need assistance in the day-to-day tasks that you and I take for granted, such as bathing, getting dressed, putting shoes on. They don't know any of it. Any of it. So, when anybody tries to assure you, but those who really need it are going to keep services, be afraid. Be very afraid. The last thing you need on planet Earth is somebody outside the service system who knows absolutely nothing in regards to funding to be there determining which person really needs services and who doesn't. Okay? It's not good. A little bit over my rant. We're going to do a brief trigger warning, and we're going to get into this here that was put up on the ARC's main website. It is called Medicaid at Risk, What Cuts Mean for People with Disabilities and All of Us. Alright folks, on this channel over here at Spilling Tea, we do have it marked not for kids for a reason. I am an Army brat that was co-raised by a truck driver. So, I do use profanity. I am not very good at being mindful for whenever it comes out of my mouth. I apologize for that in advance. Also, on this channel, we do cover some very dark topics. In particular, places like the Judge Rotenberg Educational Center out of Canton, Massachusetts, as well as Agape Boarding School and Circle of Hope Boarding School that was out here in the southwest parts of Missouri, Tobin World out in California. You will see vivid descriptions of and catch surveillance footage of people with mental health issues and disabled people getting tortured and abused. If you do got young children, please use your headphones. If your kids are 16 or younger and watching, parental supervision is something I very much advised. Alright, now this release, folks, look at that date. Look at that date. Right there. Right during inauguration. So if anybody's sitting there thinking that this idea of possibly gutting Medicaid is new, it isn't. We've all been made well aware of things that we are facing, and we have been working as much as we can behind the scenes. But at this point, I've seen way too many people talking on things they're not very aware of. So I wanted to do this mini series to help you understand why the disability rights movement, the neurodivergent rights movement, the movement for folks with mental health for better health care, all of us are converging in regards to this. You need to understand why. So, let's get into the article, shall we? It's written by Jackie Dilworth. It is a plea to journalists. They need to start covering this correctly and talk to the individuals who actually work in the field, those who work for places like ARC that receive that funding to provide these services. Okay? You all need to be as bleakly aware as those of us who've been in the service system are very bleakly aware. Okay? Alright, journalists, Medicaid is under unprecedented threat and the impact will be felt nationwide. As newly elected officials take office, many are considering cuts to Medicaid to fund other priorities like tax cuts, deficit reductions, or shrinking the size of the federal government. While Medicaid has been widely covered, from its role in public health to challenges during the unwinding of pandemic protections, the disability angle is often overlooked. All the goddamn always. All the time. All the time. And when we're not overlooked the way that it's talked about, when it is the few times it is on the news, you can clearly see that folks really don't understand how that funding works, where it goes to, what it all covers, and what massive cuts actually mean to those who need those services, okay? Everybody's under threat. Literally everyone who has Medicaid. Even those that the rest of the world would agree and determine need it the most. Okay? Let me continue here. This evolving story is about more than health care. It's about the dignity, independence, and the stability for millions of Americans. Medicaid is a vital and Medicaid is vital to the health and stability of the U.S. healthcare system, and the 80 million Americans it covers, including people with disabilities, children, low-income adults, and seniors. Now we're going to get to what Medicaid provides. Alright. Home and community-based services, such as those one receives at ARC, NOVA, Udivine Centers for Autism, you get where I'm going with there, that help 4.5 million people with disabilities live, learn, work, and participate in your communities. In particular, places like Sassafras, in particular, where it does cover their direct care staff and assistance with things like bathing and what have you, but they're also in their own apartments living it's actually a really cool place, very interdependent, it's very relaxed, and the people are the best, both staff and Elaine and no, I'm not talking Brenda Hoff. I'm talking about nice Elaine who knows how to make the best ninja smoothies on planet Earth. Just saying. Just saying is all. Let me continue here. Early intervention for young children, school-based therapies, and equipment and technologies often excluded by private insurance. These are the extra supports, folks. Funding in regards to getting kids that need it the most into places such as Rivendell, for example, to best assist with their particular issues. Talking assistive equipment for nonverbals. They have really cool electronics where you get this little board. Some of them have pictures, some have words, but they can tap on them and help communicate to our not autistic brethren. You get what I'm going here. It covers noise-canceling headphones, weighted blankets, weighted vests. And yes, where I am on the spectrum, I'll say it. Weighted blankets are necessary for my existence. In particular, when I am stressed out to the max. Before I got my current medicine, the only thing that kept me from going off the deep end is the fact that I pick heavy blankets and wrap myself up in it like I'm a mummy and essentially stare at my TV and distract myself watching really old cartoons until at least some semblance of sanity would return. It helped a lot, and it's probably why, although I couldn't keep up with everything, I was able to still continue to get up and go to work and stuff. But anyways, moving on, job skills training. Remember guys, I covered this yesterday. We're talking job coaches. We're talking the job coaches that work hand in hand with Voc Rehab. The funding that Voc Rehab has to help people with developmental disabilities obtain jobs out there into their communities. Okay? It enables to find meaningful integrated employment opportunities. I have been through that service. It didn't work very well. A lot of that was me. Fast food is sensory hell, people. I can hear the fry machine beeping high-pitched in my worst nightmares. Alright? But essentially, it helps us get jobs out in the community. Places like getting jobs at the library, getting on, helping with the food service up at Mercy Hospital or over in Cox, helping people distribute. You get where I'm going there, right? Yeah. One of every $6 spent on healthcare in the U.S., making it the nation's largest single source of health coverage. So what does that cover? I'm glad you asked. I'm one of the people that it used to cover. Let's see here. It covered my therapy. Both my psychologist as well as my regular counselor, or the person I trusted the most to go and talk about the dark things that have happened to me in my life, which is, there's way too much. If somebody ever wrote the script of my life and turned it into a movie, nobody would believe it. Just say it's that bizarre and insane. But another subject entirely. But covered my therapy, still covering my therapy. It covers my medications right now. For example, if I were still on Medicaid, I would be getting Paxil. My copay back in the day was about around $20 every time I had to re-up the script. It covered my transportation to and from work. You see, with these spasms in my legs, until someone comes up with a miracle treatment that will stop the spasms provably for 6 months, I am not going to be allowed to legally drive. Which sucks, because I was getting kind of good before all of that happened. You don't know how limited being without a car is until it's your entire life. It sucks. Alright? It sucks. I can't tell you all. And it's slightly claustrophobic in a way, because you have to rely on others. You can't just go places and leave when you want. Again, besides the point, but it covered my transportation to and from work. It covered transportation to grocery stores. It covered transportation to and from my medical appointments. It covered a great deal, folks. Okay? It covered a great deal. I would have been sunk without it. Let's put it that way. It would have not been pretty. It covered also my community integrator, the one to help me during that transition era. And by transition GOP, I mean specifically transitioning from high school to workforce or secondary education. I hate to have to say it exactly like that, but considering what I've been seeing in the news lately, apparently it has to be spelled out to them like they're 5, so that's what I specifically mean by that term. That is what it's always been called in the service system. You people are obsessed, you have issues, and need to seek therapy. I'm just saying. Neurotypicals are not okay. It's a light-hearted joke, folks. Okay? Alright. Medicaid also covers support for schools, hospitals, local economies. It works very close with special ed in particular. I did a few trips to, it was Ozark High School, and there was one out in Stratford and Reed Springs as well, where we would go out there to kind of help and assist where we can with assistive devices, mainly because special ed departments are gutted even more, if you can believe it, than Medicaid usually is. A lot of special ed teachers, often out of their own money, provide school supplies, bags, what have you. They are running on skeleton budgets. So we would go in there and try to help where we could. If we could get direct care staff in there, if they specifically need that little bit of extra assistance depending on the student, it covers that as well. It also covers all the local stuff. Out here there is a specific service, a van, I believe they call it OATS, and people with disabilities can book it to a phone number to come and take them to and from medical appointments. It covers that. Oats is a local business, so that money goes right back into the economy. You see what we're going with here, right? Okay, now we're going to start getting into some things that I've been telling you over the last 2 videos. Yeah, Medicaid is already stretched thin. 711,000 people are waiting for HCBS. As I told you guys, those waiting lists are way out of control. Way out of control. You've got people waiting 5, 10. Some people have been on the list for 15 years and still haven't got through yet. Put that in the back of your mind there. 73% of which are people with intellectual and developmental disabilities, especially us poor neurodivergent fucks. We are almost always just about left out, and we literally do kind of end up with the scraps. Forgive me if I offend anyone with that statement. That is simply my experience, and if I must, I'll say allegedly. 40% turnover among care workers due to low reimbursement rates leaves families without critical support, which negatively impacts their careers and finances. That Medicaid funding is a lot of what determines whether a service provider can afford to hire more direct care staff or not. It also is very much in control in regards to how much we are able to pay direct care staff per hour for their services. If Medicaid gets cut, hourly wage gets cut. when hourly wage gets cut, what do you think happens? Yeah. Medicaid does a lot of that funding. That's where those salaries are coming from. Every time there's a cut, what we are able to pay direct care through means of Medicaid gets lower and lower and lower. And folks, these are high-stressed jobs. Okay? High-stress jobs. Whether it's developmental disability or physical, a lot of these direct care workers are stressed beyond capacity. All right? Way beyond capacity. And the hours, the very few direct care workers who try to hang in there, it gets, because of the shortage of willing workers, you've got the ones who are still there working way more hours than they should be. Okay? It's not good. All right. 25 million Americans lost Medicaid coverage after pandemic protections ended, often due to paperwork issues, not ineligibility. And remember, folks, when we have transportation issues, like myself, coordinating transportation to do necessary paperwork is some of the most stressful parts of our lives. When you don't have that car, when you don't drive, it is usually a feat of engineering to be able to arrange that. I mean, that's why I am here in the city of Springfield. I don't like it here. It's noisy. Everybody stares at me and talks to me like I'm 6, unless I'm related to them or they're my very long-term friends or allies. But with transportation, yeah. People who already live out in the more rural areas of my state, it's a nightmare, people. It is a nightmare. Gas isn't cheap. And I can tell you from Pierce City to my city, it's about an hour and a half drive. That might not sound like much, but take a look at the gas pump lately. Now imagine that to and from. You see, this is why we can't listen to them, but people who really need it, because they don't really understand what that really is, 1, and 2, they don't even know how the funding is spent. You are essentially having someone cut Medicaid who doesn't even understand or comprehend what it is they're cutting. Okay? That was the point I was trying to make. The stakes for the disability community. Medicaid is the cornerstone of daily life for over 10 million children, adults with disabilities, funding 77% of essential services for people with intellectual and developmental disabilities. Without it, many would lose their independence, forced into nursing homes or state-run institutions. Now, Missouri's done away with a good majority of the state-run institutions. What would end up happening is they would end up going into the Burrell and Mercy and Cox psychiatric units inside their own medical hospitals. States would face severe constraints on eligibility and funding, leaving families across the country without options for vital services. Services are not cheap. No, not even for someone like myself. What was spent on me in regards for transportation, medication, assistance with HUD housing, folk rehab, job coaching, extra supports for college classes. If I ever had to actually pay that back out of my pocket, if I ever had a kid, my great 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 grandkids would owe them money. Okay? It's not cheap at all. Now, gonna go a little bit further because I do want to finish out this mini series here. Why now? The 2025 federal budget debates will decide Medicaid's future. Proposed cuts would deepen waiting lists, which are already bad. Worsen the care workforce crisis. Folks, we are facing right now extreme shortages in regards to available drug care staff who are trained properly and have proper licenses and credentials. It is looking pretty bleak already. And destabilize our healthcare system. Reducing federal funding for Medicaid could also cost states billions annually, especially states like ours where the majority of the population live out in rural areas. We are not rich folks. Leading to an unprecedented rise in uninsured rates and health inequities. Medicaid has overwhelming bipartisan public support, with 75% of Americans viewing the program favorably. So your audience must understand the real-world consequences for people with disabilities and their families. This story isn't just about policy. It's about people like Diane and her son, Jonathan. We're going to read through it real briefly, and we'll go ahead and close out for this one. My 31-year-old son, Jonathan, is a vibrant man who cherishes life. He enjoys nature photography, outdoor activities, music, and time with loved ones, much of which has been made possible through Medicaid. At 2 weeks old, he fell ill with meningitis, and now is quadriplegic, nonverbal, and requires round-the-clock care. Medicaid has been crucial for his entire life, from durable medical equipment to in-home support. Remember what I was telling you about? Do you want to even guess how expensive all those services are? Yeah. Without adequate funding and person-centered policies, Jonathan risks losing the life he loves. Federal decisions will determine whether families like theirs can have the access to care they need. Your reporting can eliminate these stakes, drive accountability, and protect Medicaid before it's too late. Now, I know this was addressed specifically to reporters, but I wanted to go ahead and read through it because this really covers it extremely well. This is a very good snapshot in exactly what is at risk here. Because when you're talking about families like that, without Medicaid, I wouldn't be able to afford it. Okay? There's no way in hell I would be. When I tell you it is life and death, I'm not overblowing it. I'm being as direct and literal as I possibly can. So what can we do about all of this, right? What can we do about it? You can learn here, ARC is an excellent resource for advocacy. Whether you are disabled or not, they have a whole lot of materials, including phone numbers for your state representatives. Like, take a look here. This is the Get Involved. We've got self-advocacy, the Alumni Council, both allies and us. Become a sponsor, the ways to donate and give. ARC has always been excellent in regards to giving people resources to help them get out there, advocate, and spread this information out into the public. They're also really great about providing materials that you could take to your representatives, either at town halls, or if you're crazy like me and you want to go to Jeff City and sit out their doors until they come in their office in the morning, because yes, I've done that. No, I'm not sorry, I'll do it again. This is a really great resource. So, as always, folks, I've got that link in the description box. Please use it. Please use the materials that ARC has painstakingly put together. They're always brilliant. Get a hold of your representatives. Hold these people accountable. But most of all, folks, let me drive this home to you. You cannot, I can't overemphasize it. You cannot trust these people when they say we're gonna cut Medicaid, but the people who really need the services are going to be fine. Because no, they're not. We have this thing to learn from called history. I was a part of during the time of the last major cuts. I can tell you firsthand the devastation that that has caused. And the fact that the reason why our waiting lists are so out of control right now directly stems from those cuts, as does the massive shortage in trained, licensed, certified, proper direct carers. Okay? Alright, now we're going to go ahead and close out for this mini-series here. I really appreciate those of you folks who were willing to hear me out on all of this. We don't get very many views on this channel. The few we do tend to get removed from time to time. So folks, if you could, please don't forget to hit the like button, hit subscribe, and please don't forget to hit those comments. I do appreciate your time. And as always, folks, we here at Spilling Tea hope you have a good one. I will see you all later. Bye-bye, everyone.